Hello and welcome. Today we'll be discussing aortic aneurysms, a potentially life-threatening condition affecting the body's largest artery, the aorta. We'll explore what they are, what causes them, how they're diagnosed, and what can be done to manage and prevent them. This video is for educational purposes only and should not be substituted for professional medical advice. So, what exactly causes an aortic aneurysm? The aorta, constantly under pressure from blood flow, can weaken over time. Several factors contribute to this weakening. The most common culprit is atherosclerosis, or hardening of the arteries, where plaque builds up inside the artery walls. High blood pressure is another significant risk factor, as it puts extra strain on the aorta. Genetic conditions, such as Marfan syndrome and Ehlers-Danlos syndrome, can weaken the aortic wall from birth. Other less common causes include infections, injuries from trauma, and certain inflammatory conditions. Let's delve into the pathophysiology. An aneurysm is essentially a bulge or ballooning in the wall of the aorta. This weakening is caused by the degradation of elastin and collagen, the proteins responsible for the artery's strength and elasticity. As the aneurysm grows, the wall thins and becomes more susceptible to rupture or dissection. A rupture is a complete tear in the aortic wall, leading to massive internal bleeding. A dissection occurs when blood tears through the inner layer of the aorta, creating a false channel between the layers of the artery wall. Both rupture and dissection are medical emergencies. Aortic aneurysms are more common than you might think. Abdominal aortic aneurysms, or AAs, are more prevalent than thoracic aortic aneurysms, or TAAs. AAs are typically found in older men, particularly those with a history of smoking. TAAs, while less common, can occur in younger individuals, especially those with genetic predispositions. The incidence of both types of aneurysms increases with age, and risk factors like high blood pressure and smoking significantly contribute to their development. The tricky thing about aortic aneurysms is that they often don't cause any symptoms until they become large or rupture. When symptoms do appear, they can vary depending on the location and size of the aneurysm. A thoracic aortic aneurysm might cause chest pain, back pain, hoarseness, difficulty swallowing, or shortness of breath. An abdominal aortic aneurysm may present with a deep, constant pain in the abdomen or back. However, remember that many people with aneurysms feel completely normal, making screening and early detection critical. Diagnosing an aortic aneurysm typically involves imaging tests. An abdominal ultrasound is often used as an initial screening tool for AAs, as it's non-invasive and readily available. For both AAs and TAAs, a CT scan or MRI provides detailed images of the aorta, allowing doctors to accurately measure the size and location of the aneurysm. An angiogram, which involves injecting dye into the blood vessels, can also be used to visualize the aorta and identify any abnormalities. Early detection is key, as it allows for timely intervention and prevents potentially life-threatening complications. Aortic aneurysms are generally classified based on their location: thoracic, affecting the aorta in the chest, and abdominal, affecting the aorta in the abdomen. Thoracic aneurysms can be further divided based on the specific section of the thoracic aorta involved, such as the ascending aorta, the aortic arch, or the descending aorta. Aneurysms can also be classified by their shape at fusiform, which is a uniform, circumferential widening, and saccular, which is a pouch-like bulge on one side of the aorta. Treatment and management of aortic aneurysms depend on the size, location, and growth rate of the aneurysm, as well as the patient's overall health. Small aneurysms may be monitored with regular imaging scans to track their progression. Lifestyle modifications, such as controlling blood pressure and quitting smoking, are crucial. When an aneurysm reaches a certain size or shows rapid growth, surgery may be necessary. There are two main surgical options: open surgical repair, which involves making an incision to directly access and replace the damaged section of the aorta with a graft, and endovascular aneurysm repair, or EVAR, a less invasive procedure where a stent graft is inserted through a small incision in the groin and deployed within the aorta to reinforce the weakened area. While you can't completely eliminate the risk of developing an aortic aneurysm, there are several steps you can take to lower your chances. Maintaining a healthy blood pressure is paramount. Regular exercise, a balanced diet low in saturated fat and cholesterol, and avoiding smoking are all crucial for cardiovascular health. If you have a family history of aortic aneurysms or a genetic condition known to weaken the aorta, talk to your doctor about screening recommendations. Early detection and management of risk factors can significantly reduce the likelihood of aneurysm formation and rupture. The prognosis for individuals with aortic aneurysms varies depending on the size and location of the aneurysm, the presence of other health conditions, and the timeliness of treatment. Small aneurysms that are closely monitored often have a good prognosis. However, Untreated aneurysms can rupture or dissect, leading to a high mortality rate. Recent advances in endovascular techniques have improved outcomes for many patients, offering a less invasive alternative to traditional open surgery. Research continues to focus on identifying genetic markers for aneurysm development and developing new medical therapies to slow aneurysm growth and prevent rupture. With ongoing research and advancements in treatment, the outlook for individuals with aortic aneurysms is continuously improving.